For those living on the streets, even minor health problems can become life-threatening.
It's hazardous and it's dangerous to them, but they survive. I mean, they try to survive through the heat and the cold and the wind and the rain. So all those different environmental factors put together compromise their health, their respiratory system, their diabetes, their diet.
Not all healthcare happens inside a hospital. On a regular basis, a group of UCSF Fresno medical residents and nurses provide free health services at a clinic inside a homeless shelter.
Here, you go to where the patients live. So what you see is what you get.
And what the residents from Community Regional Medical Center get is a chance to help the most needy members of their community.
You know, when I first figured out I was going to be homeless, I absolutely got terrified. I mean, I went into a deep depression because it's never happened before. Up until I got in trouble, with the law, I'd had a nice life, but then my addictions got the best of me. I worked for the same company for 25 some odd years, and then it all went down the toilet because I got stupid. People's lives can take a turn for the worst. 10 years ago, 15 years ago, you told me I was going to be homeless at this time in my life, I would have laughed at you. I ain't laughing now.
Cece Lamelli is a family nurse practitioner and part of the UCSF Fresno Medical Education Program. Today, she is caring for those living at the Poverello homeless shelter.
So yesterday we had a meeting about your diabetes.
Okay.
So today we want to kind of go over what you think the plan should be for your diabetes and make sure that you're aware of what's going on, okay? Because we know about your diabetes and it's been hard. One thing that came up was the point about insulin. Okay, so we would start on a small dose at nighttime, and you would give me the syringes. We would basically work here. I would do it here this afternoon, like around 5 o'clock or 4:30, and give you an injection here so you get used to it. And then once you get used to it, then you'll be doing it yourself.
It's not going in the arm, is it?
No, well, it will probably use.
I can't handle that arm.
We'll probably go ahead and use your abdomen.
Okay.
Because that's the more
I've
successful.
seen a lot of guys do that.
Yeah, and so there's different sizes you can use. You can use your arms, your abdomen, and your legs.
Okay.
So we would go over the different sites, but I think initially we'll just start with your abdomen because it's easier for you, and then it's more accessible, and then we can
I got a
just.
bigger target.
I was going to say that part, but.
Yeah, I know you didn't want to do it.
But that way we know, and then we can go from there. I'll do everything we can to get you to the right place as far as your diabetes, and then if you can meet me there, that would be great.
In downtown Fresno, the homeless congregate at the Poverello House. It's a safe haven of sorts, where shelter and health care are provided.
Now, I know initially we talked about decreasing sensation or tingling feeling in your legs and your fingers. Is that still going on, or has that gotten better?
It's gotten better. I'll have occasional feelings in my feet where it feels just warm.
8 months ago, Andrew was living on the streets. He was abusing cocaine and alcohol.
Now, how's your footwear? How's your footwear, your shoes? Are they pretty comfortable?
Yeah, I asked for, I got like 5 pairs of shoes. I change them daily, try to,
Okay.
I don't want to wear the same shoe every day.
Okay, because that's one of the things we want to avoid is you having ulcers in the bottom of your feet or in between your toes, because as a diabetic, some people tend to have decreased sensations, so they can't feel the ulcers at the bottom of their feet and they can get infected. Overall, your recovery is excellent. You haven't taken drugs in quite a few months, 5 months now, actually 8 months, right? No drugs in 8 months. Your blood glucose is very well controlled. And the next step is weight loss. I know you have a family and you have a young daughter, and you want to work hard for them and really improve your health. Okay. Any more questions?
We actually grade or evaluate our students and residents based on professionalism. But professionalism for me is not how you look or your demeanor. Profession is how much you value your profession. That's taking care of another human being. And for me, that's the essence of our medical profession. If you are there able to relieve suffering and pain for another human being, you're being professional.